Welcome back to Toledo Clinic TV. Our guest for this segment is Dr. Pumerantz, and we'd like to use the next few minutes just to get to know you a little bit better and why you got into medicine and specifically why into rheumatology.
Oh wow, great questions, and thank you for having me on today. I guess the big reason why I got into medicine, I love taking care of patients, and in my family, my uncle, Dr. Pumerantz, he started a medical school out in California, and it always was a part of my life growing up knowing that medicine was possibly in my future, but not until I joined the military and then started medical school, fell in love with internal medicine, knew that I wanted to take care of the dynamic, complicated diseases. It wasn't until then that I really started to get an appeal for rheumatology. Three big reasons why I love rheumatology. Number one, it's the chronic inflammatory diseases that are dynamic, constantly evolving, and we have access to exciting medications that essentially are the product of some of the best science of today. Second big reason, honestly, are the procedures. A patient can walk in to my office using a cane, sometimes in a wheelchair, hurting due to pain. With a procedure, an aspiration of the joint, removing fluid, I can help out with the diagnosis, inject with medications, and they can walk out without a cane or without using their wheelchair. So immediate relief, the procedures, and then the third thing are the mystery cases. Oftentimes, the diseases that we manage are a combination of symptoms, lab abnormalities, affecting multiple organs. Imagine lung disease, heart disease, brain disease, skin disease, in addition to joint swelling. And unfortunately, no answers oftentimes go on, and the patients do not have diagnoses. So the rheumatologist is called in to kind of fit the pieces of the puzzle together and are oftentimes able to complete the puzzle and come up with a diagnosis. That, quite frankly, is very appealing. So the chronic diseases, procedures, and the mystery cases, those are reasons that always keep me from boredom and are reasons why I love the profession.
And you had kind of an interesting path. You didn't go directly from your undergrad into med school. You were in the military. Talk about that a little bit.
Yes, absolutely. I actually went to undergrad at Dartmouth and played football and on a scholarship, and then was a psychology major. I actually thought my heart was more in psychology until I realized that studying the body and taking care of the entire patient and studying medicine is really where my heart was. I spent some time doing service work and leading trips to Central America, community service organizations, NGO organizations. I was able to be a part of and in some parts lead, helping out third world countries that helped to transform not only the people that we brought down there, but also me into instilling compassion and a love of helping out the human condition. I then joined the military, got into medical school, and the rest we've kind of already discussed. Falling in love with rheumatology, kind of all the pieces came together, and I'm quite happy right now.
So it's just a passion for you to be able to help people and take care of patients.
I'm hardly ever bored, and it's quite exciting. Every single patient is a unique case, and I'm honored on a daily basis and quite humbled on a daily basis to take care of my patients.
It's great to spend some time with you and get to know you better. Thank you so much.
Thank you again for having me on your program.
You're welcome. And we'll be right back.